I always knew I would be a doctor. I wanted to be a physician who took care of women. I'm a vaginal surgeon. I take care of women with problems with the vagina, the vulva, or just sexual concerns. That can be everything from postpartum birth injuries to women who are going through menopause to women who are battling cancer. Many of my patients have searched from doctor's office to nurse practitioners. They've gone to many other places before they've come to me. And so I have to really hear their story. That's the most important thing for me. I really focus on just sitting to get to know them that first visit and listening to what they've been struggling with. I find that initial investment in time yields trust, yields a relationship where we could work together to solve her problems from that point forward. Having a woman sit in my office who has been to many other places before and has had some, either treatment with me or surgery with me and is now seeing me for follow-up and is telling me that her life is normal again, and she can go play with her children without worrying about pain. She can be intimate with her partner without worrying about pain. She can just focus on living her life and not focus on her other issues that brought her in the door. That is the greatest reward.